All right, everybody, welcome to another edition of What's What BR. Today we have Dr. Stewart Gordon with us here. How are you, Dr. Gordon?
I'm fine. Good morning. Thanks for having me.
Not a problem. I appreciate it. You are from Louisiana with Louisiana Healthcare Connections, also Centene as well, just but kind of running wearing two hats. But for anybody that doesn't know, kind of what's your background pediatrician? We talked a little bit before, and some history at Earl K. Long Hospital, but kind of what's the background? Maybe what's a little bit of that? Where it got you today? What do people need to know?
Okay. Yeah, I'm a pediatrician by training, born and raised here in Baton Rouge. Went to LSU undergrad and then moved down to New Orleans for med school and residency training as a pediatrician at Big Charity and Children's Hospital. Came right back to Baton Rouge and worked at LSU Earl K. Long for almost 20 years, teaching, taking care of med students, residents, obviously a lot of patient care, predominantly working with the underserved Medicaid population or free care. Also spent quite a few years overseeing the care of kids incarcerated in Louisiana juvenile secure prisons and detention centers. So I had quite a fascinating, interesting, never boring career doing that. And then about 2012, right before the closure of Earl K. Long, I was approached by some of the Medicaid managed care companies. The state of Louisiana was sending, basically privatizing their Medicaid system, farming that out to companies skilled in managing Medicaid for large populations. So I became a chief medical officer for one of those plans and then transitioned to another one. So I've been doing that for about 8 years now. And so Louisiana Healthcare Connections is one of the five Medicaid managed care companies here in Louisiana, managing the Healthy Louisiana program for the Louisiana Department of Health. We have a little over 500,000 insured lives. With the expansion of Medicaid several years ago, that increased the role significantly. And so what we do is we're basically an insurance company that help make sure we have enough physicians in our network statewide to take care of the medical behavioral health needs of the Medicaid population in Louisiana. We have contracts with hospitals, providers. We do case management, care coordination, things of that sort to really help the Medicaid recipients that are members of our plan access the care that they need, so that the goal is to improve the community one member at a time, improve their outcomes, improve their health, being good stewards of the state dollars and reducing expenditures, but also getting the members, the patients, the medically necessary treatment that they need.
You were halfway through explaining that, and I was about to have to say you have to break that down on where I wasn't following, and I guess just my ignorance from the state would outsource it, but it kind of makes it sound like at the end of the day, if I try to sum it up in layman's terms, instead of the state maintaining their Medicare, Medicaid program, they would outsource that because they don't have the resources, the staff, the people, the know-how, and say, hey, look, you guys manage this for us because you guys know what you're doing. Is that a
Right.
fair?
They basically are managing, yeah, they're managing the contract. The way that works is the state puts this out on bid into a request for proposals every 3 to 5 years. And companies like Centene, we're the Louisiana plan for Centene, which is based out of St. Louis, Missouri. The other participants are United, Aetna, AmeriHealth, Caritas, and Healthy Blue. So those are the five that were awarded the contract to manage the entire Medicaid population, which is a little over a million, probably 1.5 million lives, I think, in Louisiana or on Medicaid.
Wow. So, what is, I always like to kind of ask everybody, you mentioned did I hear right, the chief medical officer, for them? Is that
Correct.
right?
Hmm.
So,
Yes.
what is a regular day in the life? Kind of how's that, to bring that into, I get up usually every morning, I'm running kids to carpool, I'm trying to keep up, I'm trying to get into the office, answer questions, help work with advertisers, work with editorial, what's it like to be, a CMO of, you got 500,000 people, it sounds like, that are, not to mention then staff on
Yeah.
top of that, that are
Right.
relying on accurate decisions.
Well, I wear a lot of administrative hats, as they say, and I tend to be kind of in the relationship business at this point, where because I train a lot of the pediatricians around the state and worked with a lot of med students and whatnot, I know a lot of doctors around the state, been involved in some of the medical associations over the years. So it's good to have that personal touch and knowledge with the actual physicians providing the care. So one thing I do is reach out to them, make sure that, their needs are getting met, that we're supporting their patients, our members, in the way that they need. They'll call me. They all got my cell phone if there's a problem with whether it's medical related or getting the bill paid, or how do they connect a member to a certain specialist that maybe they can't get them hooked into. So you never really know what you're going to get each day. I also have a team of doctors that work with me. We have 3 psychiatrists and 3 other physicians, 2 internal medicine doctors and 1 pediatrician. So they review cases for what, if a patient needs a service. Some of them require review for approval to determine if it's medically necessary or not. So that team of doctors stays pretty much busy all day long doing that type of work. We also, like I said, I get involved in some of the business aspects, working with a contract team to kind of develop new programs. It's kind of called value-based contracting now, where instead of just physicians getting paid for volume, we're trying to make sure that quality is a component of those visits. And instead of it just being kind of a rat race or a mill, just seeing as many as you can every day to make ends meet, the idea is to maybe have a little bit more global approach to the patient and discuss more, look at the whole patient, behavioral health, physical health, social determinants of health is a big thing now, trying to figure out if housing or food insecurity, things of that sort, or what's limiting their ability to take good care of themselves. So those are kind of all the big things that we work on.
Is that some of I've heard the term in the medical world, it's come up in the last probably 5 years. Is that the meaningful use? Is that kind of where it jumps in on some of that stuff?
Well, meaningful use is considered, that's tied to the electronic health records. A few years ago, when we went to a lot of electronic medical records, in order to use them, it had to be determined that you had meaningful use of your records. I think for your record to be certified, if I'm no expert on that, but I think that was the shift into electronic medical records. And if you had meaningful use, you could get some help with developing your EMR system as a provider.
Gotcha. Well, tell me, to kind of jump, into a couple of things that, I've heard through the grapevine, and maybe you probably know more, on this stuff. We're all living with the 800-pound gorilla still, which is COVID in the room. Try not to make this all about that, but, there's been talk, or I've heard different things around, COVID has, this impact of diminishing, the routine immunizations for children. Is it, whether it be from, scared to go into a doctor, don't want to do this, don't, have you heard of this?
Oh yeah. And that's been one of the biggest, well, not only COVID in and of itself, but I guess one of the big side effects of COVID is whether it's pediatrics or adult, the lack of folks' ability to maintain their wellness. And in the pediatric space, the big concern is we've seen a big drop off in families taking their children in for their well child checkups, especially in the early years, like the first 3 to 4 years of life, when you get most of your immunizations. So, and rightfully so, folks initially were skeptical about going into the doctor's office. We were encouraged to not go, just for public health concerns, not knowing too much about COVID. But now that we know a lot more about it and the vaccines are here, it's really important to get kids caught up with their immunizations. We've seen a drop off in routine immunizations in 2020. And, these are immunizations against diseases that are preventable that we're aware of. Whereas COVID is something we're not that familiar with, and we're beginning to get vaccinated for, so everybody's getting that. But we don't want to see the return of diseases like measles and whooping cough, Haemophilus influenza, meningitis. A lot of these, folks just have not heard much about because we've done such a great job of immunizing our children. I believe immunizations were the second in the top 10 list of the most important developments of the 19th century, just behind sewage and water treatment. And just the amount of disease that's disappeared because of vaccines, ranging from polio to measles to mumps to now different types of meningitis, as well as preventing cancers with the HPV vaccine. There's just been a huge drop off. And with the attention on COVID, we've seen that drop off. And so we're really encouraging families of small children and all age kids to call their pediatrician's office, their family doctor, and get plugged back in and get caught up, because the visits are safe. A lot of them have put in good protocols to make sure that, people feel safe and secure when they go into their physician's office without risk of catching COVID or being too exposed. So we really want folks to go in and get caught up.
I'd mentioned to somebody that I was wanting to talk about this question before the show, and the thing was, they had mentioned, they were like, wow, you're right. It was a blur. Kind of the 2020 was just so much happened, so impactful that you didn't even realize, it's like, we completely didn't do that, 18-month checkup, or we didn't do, this. They were saying, like, yeah, I'm gonna have to make that call. Just completely, it wasn't that they were even worried, or that the pediatrician wasn't open, or they couldn't do it. They just straight forgot, that they were supposed to go in, and do it. And I think that's so many other things that just kind of got forgotten along the way, because we were all so stressed out, and we were looking at counts and what's going to happen and what's going to open. Makes, now it's kind of like, hey, let's dial it back in. Let's, get caught back up.
Right. Well, rightfully so. We were quite distracted with the pandemic, something that I hope we never see again, at least in our lifetimes. But in the adult world too, there's been recent articles, and we knew this at the time, but, women were typically going in for their annual pap smear or their mammogram. Men and women were getting their colonoscopies. All those things got put on hold. So there's a lot of backlog of routine wellness and prevention that needs to get caught up on. And then a lot of people delayed seeking attention for, what they would go to the ER for in the past, with like chest pain or strokes, and people are hesitant to go in now. And some of those symptoms have just kind of been ignored. So we know there's some pent up demand and probably some disease out there that's not diagnosed, that people need to, it's time to go back and see your doctor. We definitely want that to happen.
Yeah, no, and I think that's a lot of things. I know I could think back multiple times, people would be, oh, I need to go get this checked out, but I just don't want to go. I don't want to go anywhere around, possibly, catch it. But it's the same thing. It's, I guess, two completely different fields, from medical and health to, petrochemical, or down in South Louisiana, but both have this pent up demand of projects. A lot of petrochemical, a lot of things got, pushed back down, that we're not going to, we're going to hold on that. But then it doesn't mean you don't have to do it. Same thing on the medical side of things. It's like, you might have skipped that colonoscopy that you needed, that you're supposed to get every 4 years, and last year was the year. But you now got all those. You need to make the calls and get back in, or get the children back in to see primary. Speaking of kids, you guys, some of the things that it's not just the medical you mentioned, it's well-being, it's different things, house, those kind of things. Where do you guys find, kind of the importance of play? We've talked to some of these different, museums, and being able to go, some of them have been able to open, but they can't do things. Kids have been locked inside. We've been told, distance, away from each other. That's got to have some impact, right?
Yeah, there's a lot of literature out there now with studies looking at how this whole social isolation has impacted children's development, especially the first 5 years of life, when your brain is so formative. And we talk about the importance of play even before COVID. Folks are so caught up in academic achievement and making sure their kid's the next Rhodes Scholar and getting to school ready to learn and whatnot. We tend to forget that kids just need to play, and play is probably one of the most creative and educational things you can do. Unstructured play, just to enjoy time with your kids and let them do things that aren't structured. That simply playing helps develop a good brain. And with COVID and all the social isolation, kids have gotten a little hesitant and anxious, more behavioral health concerns through all ages, not just children, but also a lot more anxiety. And so it's important to get a release and just get out and play, whether it's outdoors, indoors, but just get away from, structure, especially in the early years, and go enjoy some good old fun. play in the dirt, ride a bike, play chase, and shut down the screens and get outside and do some things. So
that's
we tend to overlook that.
I've always said it's kind of the way I grew up, and I remember my mother would always tell me like go outside and just find some mud, just go find some dirt,
Yeah.
get dirty. And I can equate to what you're talking about, some of that anxiety. I find it funny. I've got a daughter who's about to be 13, and she will do anything and everything on that phone. She can go to town, and she's not afraid to, she'll post videos, and talk to people. And we went into we went through a drive-through to she wanted to get something from like an ice cream or something, and I'm like, hey, just order. And she like shut down, like just completely like, no, I can't talk to him. I'm like, what do you mean? You can't just tell the speaker what you want? You're not even talking to him. It really, rattled her a little bit. She's like, I've never done it. I don't know what, and I don't want to talk to him. What if I mess up? I'm like, okay, we're gonna have to fix this. You need to be able to talk to people in real life. So it's
well, on the one hand, some of the technology has been helpful, like all the kids doing remote learning. Had they not had access to virtual school, they'd have really been isolated. At least they could, get on Zoom and see one another, and they'd all put their headsets on and be like being in the classroom. So from that perspective, they did get to socialize, even though virtually, instead of being right next to one another. But nothing really replaces, human to human, face to face contact.
no, without a doubt. Every time we do this show, we've been doing it for a year now, and every episode we've done, just like we're doing now, over Zoom. And people are always like, well, when are you going to start coming in person and doing it? It's like, I'm ready, but not everybody else is ready. And then how do we logistically do it? It makes things convenient, easy. I tell people, here in Baton Rouge, I love downtown, but I'm never going downtown for a 15-minute meeting again. I've done that too many times. We'll just jump on Zoom, we'll have a call, and we're done.
I think our world has changed, and I wish I would have invested in Zoom before I even knew it existed, because that seems to be the way of the world now. Yeah, because why do all that if you can hop on a Zoom call and talk to anybody anywhere in the world for a few minutes?
I've used Zoom for years. I actually got a little award from them one year for being like one of the top 10% of the users. This was way beforehand, and I would use it every day, all day, with different projects and people with different companies. But I could never get on a Zoom. I'd tell people in town, here about, like, hey, you want to jump on a Zoom? And they'd be like, what are you talking about? Like a FaceTime? I'm like, no, it's a Zoom. And I'd be like, never mind, I'll just come to your office. So. But I think it's good. It's forced us to adapt. If anything, if we tie back on the medical side, I think it's amazing how much it's propelled telehealth, and letting people be able to not have to go to not have to go sit. The example I tell people all the time is, and I'm not a physician or even pretend to be one or have anything to do with it, but to no longer have to go sit in a doctor's office with pink eye. Like that's an easy diagnosis. It's like you can do that with a phone, call something in, and go drive through and pick up a prescription for your kid. That's got to just cut down the rate of pink eye, moving around at that point.
Well, I mean, case in point, if you look at, influenza, which is another preventable illness, tends to be, we get vaccinated for every year. With the reduction in activity and social isolation and masking, there's been hardly any flu this whole flu season, and other respiratory illnesses. If you look at the data, usually, we had 10, 20,000 people die a year from flu in the United States, and I think it's under 100 this current past flu season, because social isolation and masking, and this is universal around the world. So we really have not seen flu. Yeah. And you mentioned telemedicine. Telemedicine has been huge in helping people access care remotely without having to physically go in. But that too has also given some folks false insecurity about not going in for preventive health or wellness visits, which especially in kids, back to the immunization thing, obviously you can't get a vaccine through the telehealth visit. You got to go in for that. And we really need folks to remember to make those calls and get plugged in and get caught up with their shots.
Well, I can tell you, I don't remember who it was. Shame on me that told me. I think they told me on the show here that one of the things they found surprising, they started doing a lot of telehealth visits, and I learned it's what they called white coat syndrome, but they had a lot of people that had high blood pressure. They were coming able to take them off the high blood pressure medicine because what they found out is it wasn't really as high as they thought it was. It was just they were getting very nervous when they were going in to see those doctors, and they always had the elevated high blood pressure. And then over telehealth,
Yeah.
they noticed it went down. It wasn't, what it used to be, and they're saying it was a pretty significant amount of patients. So I thought it was interesting.
Interesting. I hadn't heard about that one, but yeah, remember the term white coat hypertension, and I guess that's
Yeah,
gone down with people because you can do remote monitoring of all. You can, Bluetooth in your blood sugars, your blood pressures, your weights, things of that sort to help manage different chronic diseases.
well, one of the things, before I get you out of here, I wanted, kind of kicking around, tooling around the websites. One of the things that it looked like was wanted to talk about was, investing in early childhood, systems, care. Where, as a pediatrician, where do you see that, for people, if we could let them know how
Yeah.
important this is?
Well, fortunately, that's gotten a lot of play here in the last decade. But what we've learned so much in the last 10, 20 years is how the human brain develops. And it's sort of the last frontier, if you will. I mean, not that there's not things to understand and learn more about in other areas of the body, but the human brain is still kind of the last frontier to understand and learn more about. But what we know now is when children are born, the human brain is only like 25% of its adult size compared to like other species, if you will, like chimps or monkeys, and their brains are 60 to 90% of their adult size at birth. So they don't have that much growth and development line ahead of them. Humans, on the other hand, we have about 75% of our whole growth, physical growth line ahead of us. Plus, that's largely impacted or predominantly impacted by your caregivers and the environment you're born into. So we have all this opportunity after regardless of how you get here, when you get here, you still have 75% of your physical growth and development line ahead of you. And then the environmental influences are huge. So what we know is by the time you're about 2 or 3, your brain's at 90% of its adult size. And by the time and then it only grows to adult size in the next, 15 years. So there's tons of activity taking place in there with what we call synapses, where the brain's wiring the different neurons that you have, brain cells speaking to one another. That all gets laid down really in the first 2 years of life, and then it's a sponge for information, just waiting for good or bad influences to make a healthy brain, if you will. So what we know is by the time our children are 2, they have the same capacity of either of their parent in terms of synaptic development. And by the time you're 3, your kids have twice the capacity of either parent. So that's sort of why we say you need 2 adult brains to match the wits of a 3-year-old. And so you're really at a disadvantage if you're alone, if you're a single mom, or if you're a daycare worker with 6 toddlers in there. You're outnumbered because their brain's firing on all cylinders, and they're going to outthink you every time and overwhelm you because you just don't have the capacity to outsmart them at that young age. So the
That's
challenge is to make sure the kids are. Go ahead.
no, 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 no. Go ahead.
I was just saying the challenge is to maximize the opportunity to promote a healthy brain as often as possible in those first 5 years. Because what we do know that the brain has most of its growth and development happens in those first 3 to 5 years of life. And then at 5, we all go to school. And if you think about it, once you get to school, half of your awake life is spent, over half is away from home at school. So that environment becomes, probably more relevant than your home environment. And then when you're home, you still have to get in 8 hours of sleep and you have time for homework. So the most influential time in our lives to be influenced by our parents and the environment is those first 5 years. So we really encourage parents to do as much as they can in those early years. And then there's a lot of people born into situations. You can't pick your parents or the environment you're born into. So if you're born into a world that's full of toxic stress, it may be harder for you to get into to be ready to get to school ready to learn and be able to sit and focus and stay on task. So the idea is to make sure we have high quality early childhood systems of care instead of child storage facilities. We
Mhm.
need better child developmental centers. They have quality rating scores that they can qualify for and get. And it's very important that all kids get access to high quality childcare. Much of this can be supported through government involvement and resources through things like the early childhood tax credits, as well as some government support for impoverished families to make sure their kids get access for that tuition. It's expensive to go to, you say you have children too, I as well. It's not cheap. Lots of times, these developmental centers are as much as college tuition annually.
Mhm.
So the more we can support every child getting access to that, the better off we'll be, and all kids getting to school ready to learn. And then you spend way less income on remediation and things of that sort. The economists have looked at this too over the years. James Heckman is an interesting person to look at, called the Heckman. If you Google the Heckman equation, and basically it's no pun intended, it's a no-brainer. Investing early and often is a way better investment than investing in later in life. What's the saying that it's easier to invest in strong children than it is to repair a broken man. So
Yeah.
if we do more and more of that, the return on investment, no matter what study you look at, is either 1 to 2 or $1 to $17 per dollar put into the early childhood system of care.
Wow. That's what a shameless, plug, but to carry the story, we're doing it in April and May. We have a pilot program. We're releasing it's a newspaper, magazine, book, but it's for kids between the ages of 1 and 5. And we've done this over in the Bay Area for a number of years, but we're finally bringing it here to Baton Rouge. But what was staggering, it's all about literacy and teaching kids and making sure that they learn to read. I was made aware of a statistic a while back, that it was amazing that most states use like a third grade reading level. They take that's a large in the algorithm basically that runs through to determine how many beds they're going to need in prisons. That you can
You're
directly
exactly right. I know
correlate.
that I have that in one of my slides in some of these talks that I give, that Indiana and California, many states will look at their second, third, or fourth grade literacy level to get an idea of how many prison beds they're going to need in 15 years. And the most common denominator that inmates have is illiteracy. So literacy is huge. The other thing that's interesting that's recently come out is kids' ability to attend to a task seen by 4. They've looked at it, and so even before you get to school, if you can stay on task at 4, that tends to be more associated with a higher socioeconomic status later in life, higher educational attainment, and much less likely to be involved in the correctional system. So it was even a better predictor of success than were math scores and literacy. So,
Wow.
and if you think about it, your ability to regulate and stay on task sets you up for long-term success. If you get to school and you can sit in a chair for a large part of the day and retain information and respond to a teacher, you're going to be successful. If you come from an environment that's full of threats and toxicity, you're going to have a higher level of stress hormone, cortisol, and your baseline is going to be sort of hyper vigilant, where you're always looking for threats, and you're not going to really be able to self-regulate, and you're going to get into an environment where you're supposed to, and then the next thing you know, you're off task, or you're diagnosed with conditions that you have to put on medications for, and pretty soon you're having some juvenile delinquency, dropping out of school, not finishing school, and then move down that path to the penal
It would,
system, sadly.
it would almost seem, and I don't know if I'm connecting the wrong dots, but I'm just kind of going back over some of the things we've talked about. If we go back to, the children, and just playing, well, just getting outside and playing is going to wear, the child out, a little bit, rather than them sitting on a screen, and, maybe it puts them to bed a little bit earlier. and then they get up and they've got that home environment that you need to come in. I remember I used to have a teacher that, in high school, I had the teacher, and he was pretty instrumental. And he's that, everybody's got that one, right? It was that one teacher. And he would, tell me that, the first thing I needed to do before I came to class was be ready to come to class and be in the class, not be dealing with outside, things. And if we've got kids that are wild, crazy, run around, staying up late, they're not tired, we hadn't worn them out yet, we haven't put a good, system of care at home, and they can feel safe, and then we can get them into school where they can be in that mindset. I talked with someone that was about the early childhood, and they were talking about that's where some of these, lunch programs and the breakfast programs come from in the schools, because some of the kids are worried that's where they're getting their meal. And if you've got a young child and they're worried about, I'm hungry and I didn't have this, high stress, at home, how do we expect to put them in a classroom and make them focus, on anything? Because their brain's somewhere else. So, and that would be, I'm equating it. I'm just kind of talking this out loud. People talk about sometimes the schools, turn into, it's like a daycare. Well, maybe that's because you physically have the body there, but mentally the child's not there. So they're not applying themselves. And you're just kind of keeping up with it. Maybe I'm tying it too far back, but it's go back and find that mud puddle, So.
Yeah. Well, it's not necessarily a bad thing for the school to be the place that you get the best influence. So all the more reason to invest in high quality early childhood and public education. A lot of kids, at least in East Baton Rouge Parish, about 80% qualify for free reduced lunch, which means they're coming from impoverished backgrounds. And that breakfast and lunch, that may be the only 2 meals they get every day. Mm-hmm. So that's why they've started programs in the summer to make sure those kids and families get those meals in the summer as well. Because otherwise, there's a lot of hunger that many of us don't appreciate. And so, how can you learn if you're hungry on top of maybe coming from a more stressed background, more stressed environment?
Well, Dr. Gordon, I appreciate you spending so much time with us and filling us in here. I always tell everybody you got better, especially someone, of your stature, you got more important things to do than sit around and talk to me. So I appreciate you making some time and, kind of letting us know what's going on, and hopefully maybe giving somebody a little bit different perspective on things. Love to have you back and kind of get an update as we're starting to talk about, I'm not the guy saying it's over, but I'm hearing more people like the pandemic in the past, tense, like we're kind of turning the corner. We're not through it, but 6 months ago, we were sitting right in the thick of it, but now people are kind of referring to past tense, or at least you can see the light at the end of the tunnel. So have you come back and let us know how it's going for you guys.
Be happy to do that, Brandon. Appreciate what Baton Rouge Parents Magazine has done for many years, like you're telling me, 31 years. So keep the good information flowing, and happy to help out any way I can. And everybody stay safe, stay masked, and get vaccinated. Old vaccines and new ones, and hopefully we'll get through this and be done with it soon enough.
As my grandmother always told me, this too shall pass. So we'll get through it. Thank you, sir. Talk to you soon.
Thank you.